Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Sun exposure. Introduction. Exposure to the sun can damage the skin and may even lead to skin cancer, but skin cancer and other types of skin damage are preventable. This program explains sun exposure and its resulting skin damage. It also covers skin cancer and how you can protect yourself from the sun's harmful rays. The sun and your skin.
The skin has a layer called the epidermis. It contains flat cells called squamous cells. Underneath the squamous cells are round cells called basal cells. Melanocytes are another type of cell in the epidermis. They make melanin. Melanin gives skin its natural color. Exposure to the sun causes the melanocytes to make more color. This causes the skin to get darker or tan.
Sun damage. Ultraviolet rays, or UV rays, are an invisible form of radiation. They can penetrate your skin and damage your skin cells. Sunburns are a sign of skin damage. Suntans are not healthy either. They appear after the sun's rays have already killed some cells and damaged others in the skin. UV rays can cause skin damage during any season or at any temperature. They can also cause eye problems and premature skin aging. Skin texture changes caused by UV exposure include easy bruising, skin tearing, thick skin, wrinkles. The sun can cause the appearance of tiny blood vessels in the skin, especially on the face. Sun exposure may also cause skin color changes, including brown spots, such as liver spots or freckles, moles, small white spots on the legs, backs of the hands, and arms. Besides skin changes, sun exposure can affect the eyes and immune system as well.
Sun exposure can lead to cataracts. A cataract happens when the lens in your eye becomes cloudy. This changes your ability to see. Cataracts develop slowly. They usually affect older people. Surgery to replace the lens may be needed. Sunglasses and hats can help prevent or slow the development of cataracts.
Repeated exposure to UV radiation can also damage the body's immune system. The immune system is responsible for protecting the body from germs and other foreign invaders. Sunburns can suppress immune functions in people of all skin types.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Skin cancer. Cancer begins in the body's cells. Cells are the building blocks of the body. Normal cells in the body grow and die in a controlled way. Sometimes cells keep dividing and growing in an uncontrolled way. This causes an abnormal growth called a tumor. If the tumor invades nearby tissues and body parts, it is called a malignant tumor or cancer. Cancerous cells spread to different parts of the body through blood vessels and lymph channels. Cancers in the body are given names, depending on where the cancer started. Cancer that begins in the skin will be called skin cancer, even if it spreads to other places.
There are different types of skin cancer. Melanoma is the most serious type of skin cancer. This type of skin cancer begins in the cells that give skin its color, the melanocytes. Melanoma can spread quickly and lead to death. Basal cell carcinoma and squamous cell carcinoma are the two most common kinds of skin cancer. Carcinoma happens first in the lining or covering of organs. Most cases of skin cancer are basal cell carcinomas that grow slowly. They rarely spread to other places in the body. Squamous cell carcinoma is more likely to spread than basal cell carcinoma, but squamous cell carcinoma still rarely spreads. UV radiation is the main cause of skin cancer. Sun exposure is the most important risk factor for any type of skin cancer. The sun's rays cause damage that can lead to cancer. Tanning beds, sun lamps, and other sources of artificial UV rays can also cause skin cancer. Where a person lives affects his or her risk of developing skin cancer. People who live in areas that get high levels of UV radiation from the sun are more likely to get skin cancer. Skin cancer is most common in South Africa and Australia. These areas receive high amounts of UV radiation. Even though skin cancer usually appears after age 50, damage from the sun can happen at any time. Kids need protection from the sun to prevent cancer later.
It is important to find and treat skin cancer as soon as possible because it can invade and destroy nearby tissue. How to protect yourself. Skin cancer and other types of skin damage are almost totally preventable. This section provides information on how you can protect your skin from sun exposure. Avoid long exposure to the sun if possible. If you must be in the sun, cover up with sun hats, long sleeves, sunscreen, and sunglasses. Wear sunglasses that wrap around the face and provide 100% UV ray protection.
Sunscreen can help protect the skin from sun damage. SPF stands for Sun Protection Factor. This is the rating used to state how much protection sunscreen offers. An SPF of 30 or above is best. The sunscreen you choose should protect against both UVA and UVB rays.
Babies should never be exposed to direct sunlight. Teach your children to apply sunscreen before they go out to play.
Whenever possible, avoid sun exposure between 10 a.m. and 4 p.m.
Avoid using sun lamps and tanning beds.
Snow, water, and sand reflect the sun, so sunburn is more likely. Be careful not to get burnt.
When to seek medical care.
Look at your skin on a regular basis for changes. These include differences in the look and feel of birthmarks and other spots. Changes in the color, size, shape, or feel may be a sign of skin cancer. If you notice any changes, check with your healthcare provider.
You should also contact your healthcare provider if you get a serious sunburn. A serious sunburn causes blisters, covers a large portion of your body. Also contact your healthcare provider if you have a sunburn with a high fever, chills, confusion, headache, nausea, severe pain. Skin damage from sun exposure may result in an infection. Contact your healthcare provider if you have signs of an infection, including increased pain, tenderness, or swelling, red streaks around an open blister, yellow drainage or pus from an open blister. If you have any raised, reddish, and rough-textured growths, contact your healthcare provider. Red, scaly lesions may be precancerous, especially when they are found on the face, ears, lips, and backs of the hands. If you are at risk of skin cancer, your healthcare provider may recommend regular skin exams by a dermatologist. A dermatologist specializes in diagnosing and treating skin disorders.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary.
Exposure to the sun can damage the skin and may even lead to skin cancer. But skin cancer and other types of skin damage are preventable.
Ultraviolet rays, or UV rays, are an invisible form of radiation that comes from the sun. They can penetrate your skin and damage your skin cells. UV rays can cause skin damage during any season or at any temperature. Sunburns are a sign of skin damage.
To protect yourself from sun damage, avoid sun lamps and tanning beds. Stay out of the sun when it is strongest. Use sunscreen with an SPF of 30 or higher. Wear protective clothing, including sunglasses. Look at your skin on a regular basis for changes. These include differences in the look and feel of birthmarks and other spots. Changes in the color, size, shape, or feel may be a sign of skin cancer. If you notice any changes, check with your healthcare provider. If you are at risk of skin cancer, your healthcare provider may recommend regular skin exams by a dermatologist. A dermatologist specializes in diagnosing and treating skin disorders. Thank you for using Explain.